My name is Jennifer Kieltyka, and I wanted to share my story with you just a little bit about craniosacral work and why I love doing what I'm doing. I was in a car accident in 2017, and I had a double concussion. I was hit by a truck on the highway, and the truck came onto my passenger side, and so my head went this way, and then I ran into a concrete barrier, and so my head went this way. I didn't hit my head on anything in the car, so I didn't even know that I had a concussion. But what happened was when my brain went boom, boom, it created this double concussion, um, which turned out to be a traumatic brain injury. So I just wanted to explain a little bit about how this led me to my work. I've been doing massage therapy for almost 28 years. I've always incorporated craniosacral work, especially when people have had head and neck tension or chronic pain in their mouth, their jaw, chronic headaches. So the cranial work has always been part of my massage practice. The other part of my work is teaching yoga and meditation, which has also been really helpful in healing after my brain injury. So I just wanted to share a little bit about what can happen when we've had any kind of brain injury and what can happen and what happened to me. So after the car wreck, I had went to physical therapy and the therapist said that I needed to go check out a neurologist to see if I had a concussion, which I did. And I went in to do all my vestibular therapy, which was incredible. The vestibular therapist helped me so much. I was having the hardest part was that my eyes were not converging. And this also made my memory really challenging. One of the hardest parts for me was recalling names or numbers in a row. And sometimes I couldn't remember things within just a few minutes. Healing my brain, healing the memory was really, really important to me. And after I graduated from my vestibular therapy, things were getting a lot better. I was able to be in public again. I had been really sensitive to sound and to light. So for me to go outside, for me to go to work, for me to teach yoga, for me to pretty much be around anybody or any noise was really challenging. So once I got through my vestibular therapy, I was able to continue with my yoga and my meditation and just being really, really gentle. But after having some of the craniosacral work, I realized how our brain continues to heal even with time, but we can still have this residual pressure. We can have headaches, we can have sensitivity to light, we can have memory challenges. And this is the one thing that I found craniosacral work to be really helpful, not only for me to receive it, but as I was working on people who had concussions, who had vertigo, who had chronic headaches. So this was all stuff that I was learning not only because of my own injury, but because people were coming in and allowing me to work gently to help them relieve their head trauma. So I just wanted to share that it can be really challenging after we finish our therapy, our vestibular therapy, physical therapy, occupational therapy, even seeing a neurologist with all the medications that they might try to give us. Sometimes there's still something that's not quite right. And that's what I found craniosacral work to be the best at, is when things are going pretty well, but we just don't feel 100% ourselves. And even though I can't say that the brain can completely reheal, a lot of the trauma can be released and a lot of balance and harmony can come back into the brain. I'd like to explain a little bit about what we do in craniosacral work. So I'm going to use our skull here as an example. The cranial bones are fused in our head, but what can happen is with a with head trauma, we can hit our head, we can fall, whatever has happened, it can put this little bit of compression in our cranial bones. So as a craniosacral worker, I'd like to come in and feel where the injury has happened, feel where the compression is in the skull and the cranial bones, and then try to hold it and relax and release it. What can happen is if we've hit our head, say we've hit our head, we've fallen and hit the back of our head. So this is our occiput. We fall and maybe we get a little bit of headache, maybe we have a little bit of neck tension, but then over time we start to have these headaches, on the side of our head, or maybe we have ringing in the ears, or we have a hard time reading or sensitivity in the eyes. So the idea is to feel where the injury has been. If it's been in the occiput, maybe we start with the occiput, but maybe we're feeling more pressure up into the parietals, the frontal, the temporal, or even the mandible. So holding the cranium and allowing the trauma to present itself, allowing the compression to present itself, or any imbalances, we just hold and we wait and we wait. And then eventually we start to feel this movement. It's the cerebral spinal fluid, it's the nervous system. Energetically, we feel this harmony start to happen. And maybe there's a little bit of decompression, maybe there's a little bit of more movement, maybe more movement in the mandible. But the idea is to find balance and harmony in the cranial bones. So after you've had an injury, we're able to feel a little bit more balance in the cranium. Working with the brain is very similar, but takes a lot more of a gentle touch. So after working through the cranial bones, maybe releasing some of the compression in the cranial bones, then we can come into feeling where the trauma has happened in the brain. This is a 1.5 times size brain for just study. So it's really cool. But the same thing applies here. So holding, this is the frontal lobe, holding the cranium and then making our way almost like through the cranial bones until we feel the beautiful brain. And the brain itself has its own feelings. Sometimes it feels where it can be flat. So maybe if you've had a brain injury, the brain will feel kind of flat or dark or quiet. And maybe if you've had a brain injury, the brain will present itself as electric or overstimulated, fiery. So it basically, we're just waiting and seeing where the trauma presents itself, where the imbalance presents itself. And then again, the same idea is trying to find this beautiful rhythm, like water flowing, an ocean wave moving through the brain and finding a nice balance. So you can imagine if you've had any kind of concussion, if you've had any kind of head trauma, even though it doesn't seem like these can be moved or changed, they actually can. So if you have headaches, if you have mouth trauma, jaw trauma, everything, as we know, is connected. So that's where we find where the biggest part of the injury is, or the biggest imbalance, and try to find some decompression. I wanted to also explain to you a little bit about craniosacral work and the whole body. So I'm going to use our skeleton here. The craniosacral. So when we talk about craniosacral work, we're talking about the cranium to the sacrum. This is our sacrum here at the very bottom of our spine and our tailbone. So the idea for craniosacral work is to find harmony all the way through the cranial bones and then down through our spine into our sacrum. So you can imagine if somebody's had a head injury, maybe it only affects their head and the cervical spine, but maybe over time they end up compensating or finding some imbalance that will move its way down through our back, maybe even in the pelvis. And going the opposite direction, say somebody's fallen on our tailbone or we've had an injury in our hips and our pelvis, our lower back area. Even though it's the injury has just happened here, we might have issues coming all the way up through our spine and then making their way up to the occiput, the base of our skull, and then it can eventually even cause problems in the jaw. So the idea again behind the craniosacral work is to find this beautiful harmony all the way from the cranium, the skull, down through our spine, our spinal cord, to our sacrum and our pelvis.